Good morning. Thank you all very much. Thank you, Dr. Smith. I've been a member of AAPS for about 5 years now, and this is my first meeting. So when he said, "Hey, you want to talk?" I'm like, "Gosh, great, thanks." It's good to have it here in Oklahoma because I only had to drive 15 minutes to get here, which was awesome. But thank you all for coming. I hope you've had a good time in our state. 50% of doctors end up living within 50 miles of their mother-in-law, and so that's how we ended up back in Oklahoma. But it's been great. Training at Birmingham, we had a tremendous surgical experience. Operated our tails off. We quit counting tonsillectomies and tubes after number 1,000. It was the very busy children's hospital. And I can remember we'd start out, there was 2 rooms, 1 attending surgeon. I'd go into the room, we'd be doing a tube. The nurse would be standing at the door with the next patient, ready to come in the room as soon as the sheets were changed, wiped down, and changed the anesthesia machine. It was just a machine, and it was unbelievable surgical experience. So I come to Oklahoma, I joined a single specialty group, large group at the time, was about 8 physicians. We've grown to 13 now. Not everyone is a partner at Surgery Center of Oklahoma, most are. There are other ear, nose, and throat doctors at Surgery Center of Oklahoma that are not our partners. That may change in the future as we work on things. But I can remember starting my practice in Norman, and I was the 4th doctor and an ear, nose, and throat doctor in a town of about 100,000. And it's a process, it's a slow process growing your practice. And so I had partners up at North Oklahoma City at the Mercy Hospital, the Merciless Hospital, as Dr. Smith likes to call it, based in St. Louis. And I had a partner, he's 80 years old, and he's just quit operating, but he's still seeing patients in the office. And he said, "Hey, if you'll come up here and do clinic 1 day a week, I'll give you all my patients that need surgery." And I was like, "Great, I need things to do." So I started operating at Mercy Hospital 1 morning a week on Wednesdays. And I would do clinic on Wednesday afternoons on one of my partners who was out golfing in his space, and they didn't charge me rent. And it was a wonderful way to build my practice. And then as I got busier, I think it was about July of 2003, I had 8 surgeries on in 1 day at Mercy Hospital. It was 3 tubes, 3 tonsils, a small sinus case, and a direct laryngoscopy. Maybe 2 hours worth of work of my operative time. I was there 10 hours. From 7 a.m. till 5 p.m. as I watched anesthesiologists wheel their carts in and out of the room as they took turns in the shift. And I did, when I was young and I didn't know to ask for 2 rooms or anything like that, but I thought there's got to be a better way to get things done. And it wasn't any faster at the Norman Regional Hospital as far as getting stuff done. And so fortunately, one of my partners, Dr. Mark Gilchrist, our current president of our group, was a partner at SCO from the very beginning, or not a partner, he operated there from the very beginning, and he became a partner after a long time because he couldn't prod his nurse into getting patients to go there very well. And so he brought me to the new place that had just opened in spring of '03, and he said, "Hey, this is much better here, you should come operate here." And I'm like, "All right," came met Keith, and started operating, and I could now do those 10 cases, or 8 cases in 2 hours, back to bam bam, and it's awesome. My stress level is so low, because he takes such good care of kids. I do probably half my practice is pediatrics. So at the time, they were out of network for everything, and out of network copays and deductibles were much lower. But it was still a lot of work for my nurse to get patients to go there. And so the best way to get someone to get motivated is to give them a bonus. And so if she could get 10 patients scheduled there, as long as it didn't cost them any more out of pocket to go to the out of network than it would to an in network, because my number 1 goal is it should never cost patients more out of pocket to go wherever I take them than it would be somewhere else. Regardless of how much it would benefit me, it has to be the best for them. And if she could get 20 cases on in a month, she'd get a $200 bonus. So a $100, $200 bonus. And for someone making $10, $12 an hour, it made her do the extra time. So incentivizing your staff, it will get them motivated to do things. And so at the time, really Coventry was the only plan that was in network, which, that was the teacher's plan here in Oklahoma. And it was in network. And I don't know how that came about, but it was. So I was able to get some in-network patients there. And then the tribes here in Oklahoma, the Chickasaws specifically, did not have an ear, nose, and throat in Ada. And I had a partner who had come from Ada. And so there was kind of a pipeline of Indian patients who would come to Norman, and then we'd take them to the Surgery Center of Oklahoma. And so things were going pretty well. And then when Keith posted the prices online, and I remember talking to my wife and saying, "Why will Blue Cross and United not contract with us? Our prices are great. We're going to save them so much money." How can this not be a good deal? And then as the layers have been peeled back and PPO repricing and learning how Blue Cross makes more money saving the self-funded companies money than they do actually in selling insurance to individuals. And so that was a long process. And so when he posted his prices online, that was wonderful for me. I mean, I've taken out tonsils from folks from Austin, Texas, and North Carolina, and Louisiana, and California, all over the country. And so I joined AAPS, and the journey continues, and I opted out of Medicare 3 years ago. It was, thank you. Fortunately for ear, nose, and throat, our practice is only about 20% Medicare as a standard across the board. Most Medicare problems in the elderly are hearing loss and tinnitus, non-operative problems. Cancer is very, very rare. I see patients in the hospital when I'm on call that are on Medicare, and I don't charge them. I don't file a fee. I just don't want to be off Medicare's radar. Fortunately, those are a small number. So now, when Governor Fallon was here at the start of the meeting, she mentioned Health Choice, which is now the Oklahoma Teachers and Employees insurance plan and is contracted directly with the surgery center, which is just spectacular. It brought to mind, people are going to say, gosh, if you're getting free surgery, if it's going to cost them nothing out of pocket or deductible for them to go get surgery, there's going to be a lot of unnecessary surgery. And the answer is no, there's not, because people don't actually want surgery. I remember when I first started practice, I would see people I'd get a CAT scan of their horrible sinus disease and their horrible polyps, and I would say, you need sinus surgery. You will be so much better if you have sinus surgery. And they just look at me and go, okay, I'll see you later, doc. And they would leave. And I'd tell my nurse, people don't like me. They don't trust me. She's, I don't know. And then 2 or 3 or 4 years later, these people come back. And they're still miserable. And they finally say, okay, doc, we'll do the surgery. So and that's how your practice grows in the ear, nose, and throat world. So people in Health Choice, they don't want their child to have their tonsils out. But if they're having strep 6 times a year and missing school, or if they're snoring, or if they can't hear and they're developmentally delayed because they can't hear, they want their child to have surgery. A lot of these people with a $5,000 deductible, they might not be able to afford it. They would put it off. I mean, ear, nose, and throat is one of the few specialties where we can do surgery on a child and improve their quality of life, their ability to grow, and growth hormone is not produced during dream sleep, and if they're snoring, they don't have dream sleep, and it causes overbites and adenoid facies. There's a reason that people look dumb. As a pediatrician friend told me once, that the face grows at the same time as the brain, and so if you're not breathing through your nose and your brain's not getting oxygen at night, it changes the way your face works, the way your brain works, and so I think it's going to do a lot for quality of life of kids and adults here in Oklahoma, this new option with Health Choice. So thank you very much. I've really enjoyed this meeting. Thank you.